vaccinate as many people as possible. And for me personally, I was able to get my third dose at the Rosedale Pharmacy when I was eligible, and the pharmacy took great care in the timely booking and administering the third booster dose. So do avail yourself of the opportunity to use pharmacies for that availability. We are committed to getting as many COVID-19 vaccines into arms as soon as possible and have started to activate resources in order to scale up many vaccine clinics in our city. I know many of you are eager to get your third dose appointment, so please continue to practice patience as our partners across the community do everything they can to increase the COVID-19 vaccine appointment volume. Everything we are doing is to protect residents and to beat this virus. So while Friday's announcement was not the news we all wanted to hear, these measures are unfortunately very necessary for us to be able to contain this virus. So it's instrumental and necessary for everyone to continue to follow public health guidelines to reduce the spread of the COVID-19 and the variants in our community. The best community service you can do for your family, your friends, and your neighbors is to get vaccinated, first dose, second dose, and third dose for yourself and all of our kids 5 and up. So those vaccination appointments are required for individuals who are eligible for their third or booster dose, and information about that can be found at hamilton.ca COVID vaccines. So go to that website and you will get some information as to when and how. We have many people to vaccinate, so patience is the order of the day. It can't all be done at once. And so I know that Dr. Elizabeth will be talking about the rate at which we're going to be doing this shortly. But at this moment in time, I'm going to pass it over to Grace Mader, our Emergency Operations Interim Director, filling in for Jason Thorne. So Grace.
Thanks very much, Mr. Mayor. As Mr. Mayor indicated, that on Friday, the province announced new measures to help slow the spread of the Omicron variant. The following restrictions came into effect yesterday at 12:01. There is now a 50% capacity limit on indoor settings, such as restaurants, bars, gyms, pharmacies, grocery stores, shopping malls, and personal care services. Food and drink services are prohibited at indoor sporting events, concert venues, theaters, cinemas, casinos, bingo halls, and other gaming establishments, horse racing tracks, car racing tracks, and other similar venues. The number of patrons permitted to sit at a table in a restaurant, bar, or other food or drink establishment and meeting and event space is now limited to 10 people, and patrons are required to remain seated. Patrons must also remain seated in concert venues, theaters, and cinemas. Singing and dancing in restaurants and bars and other select settings are not to be allowed except for the workers or performers. Bars and restaurants and meeting and event space and strip clubs that serve food and drink like a restaurant are required to close by 11 p.m. Takeout and delivery services will be permitted beyond 11. The sale of alcohol is restricted after 10 p.m. and consumption of alcohol in businesses or settings after 11 p.m. Finally, for informal social gatherings, there is a limit of 10 people indoors and 25 people outdoors. Over the weekend, our bylaw team educated over 40 businesses in higher risk settings, such as bars, restaurants, and nightclubs, about the new provincial regulations. Our operations update. As Mr. Mayor had indicated, due to the concerning rise in the number of city employees who have tested positive for COVID-19 and are self-isolating as a result of a close contact with COVID-19, and after consultation with Occupational Health and Safety and Dr. Richardson, we've made the decision to make several operational changes effective immediately. These include directing staff to work from home wherever possible, requiring staff to wear a medical mask at all times while working in a municipal workplace or in the community on behalf of the city, making changes to the city's COVID-19 rapid testing program due to supply challenges with the rapid test availability. Those staff working from home that are no longer required to submit regular test results unless they are required to come into the office. We are asking employees to avoid gathering to eat in lunchrooms and break rooms. We're asking our leaders to schedule employees with staggered start times, start and stop times in order to avoid gatherings at the start and end of shifts. We are also reducing the maximum number of occupants in a vehicle at any one time to 2 or 1 if operationally feasible. As indicated, we're looking at redeployment and service impacts. Over the last week or so, we've been working closely with Hamilton Public Health Services and healthcare partners from across the community to scale up COVID-19 capacity in Hamilton. Dr. Richardson will talk more about this, but from the city's perspective, we are doing everything we can to help staff clinics and ensure we can scale up the number of COVID-19 doses available each day. We have already redeployed about 100 staff and are currently looking at additional redeployments and opportunities as we speak. We are also planning for staff shortages due to redeployments and also looking at the impacts that staff isolation or quarantine periods might have on our operations. Senior staff are reviewing all business continuity plans and are prepared to make changes to non-essential services if needed to protect the continuity of essential services. The impacts to any city services will be communicated via our city channels, our website, and social media. Facility closures and suspension of programming. At this stage, we've had the following facilities and programs that have been closed or canceled over the past weekend to allow for the redeployment of staff to vaccine clinics. These include recreation centers and arenas, Hill Park Recreation Center, Winona Community Center, Sir Winston Churchill Recreation Center, Jimmy Thompson Pool Memorial Pool, Dundas Lions Memorial Community Center, Ancaster Rotary Center, Rosedale Arena, Carlisle Arena, Sir Wilfrid Laurier Recreation Center, and Ryerson Recreation Center. Also closed include Sackville Hill Seniors Recreation Center, Ancaster Seniors Achievement Center, the Flamborough Seniors Center, Dundas Senior Citizens Club, Rosedale Seniors Club, and the Seniors Center Without Walls programming is also canceled. All museums are closed with the exception of Dundurn National Historic Site. Additionally, effective immediately, all early on child and family centers, indoor and outdoor programs are closed until further notice. Virtual programming will continue at this time. On the enforcement front, over the weekend, 2 businesses were charged with failing to comply with the Reopening Ontario Act. And our bylaw teams also issued 2 noise bylaw charges, one to a private residence and one to a business. As always, businesses charged are posted on the website along with specific charges issued. Lastly, we are heading into the city's annual administrative break between December 25th and January 3rd. However, we will continue all aspects of our COVID-19 emergency response over the holidays. Our teams in public health, the Emergency Operations Center, bylaw, communication, and other key supports will continue working on COVID-19 throughout the break as necessary. And with that, I'll pass it over to Dr. Richardson for her update.
Thanks very much, Grace, and good afternoon, everybody. I know that the Omicron variant of concern is very much on everybody's mind as we're moving forward, and the situation here in Hamilton and across Ontario is indeed very concerning. In terms of our local COVID-19 surveillance, we're now at 27,203 cases total in Hamilton. As of today, that's a net change of 508 cases from Friday. Our COVID-19 activity levels continue to be highest in those 0 to 59 years of age. Our 7-day moving average number of cases is reported today at 113, and the weekly incidence per 100,000 is at 132. This is a doubling of the incidence since December 13th, when it was 66 per 100,000 per week. Our most recently updated weekly reproductive number is sitting at 1.32. Fortunately, as of today, the average number of daily new hospitalizations has increased only slightly, and there's 1 new hospital admission each day on average, and the average number of deaths continues to be low. However, as we know, the number of hospitalizations and numbers of deaths tends to lag behind the number of cases, and as we're still learning about the Omicron variant of concern in terms of its severity, we're very much watching those numbers closely. Our percent positivity is currently sitting at 4%, up from 2.2%, and there are 26 active outbreaks, 5 new ones being reported today, and 6 being declared over today. And of course, all the details of the outbreaks can be found on our dashboard. Ontario overall is experiencing exponential growth of the Omicron variant. The current reproduction rate and percent positivity are at 1.82 for the reproduction rate and 9.7%, with a case doubling time of every 2.7 days for Omicron in particular. Concerning data like this is overwhelming evidence as to why the province took action this past Friday to slow the transmission of COVID-19, all the changes that you just heard Grace outline. Myself and my colleagues here in Hamilton Public Health, as well as across the Ontario Public Health System, are very supportive of these measures that have been put into effect yesterday morning. We're trying to slow the spread of this Omicron variant. We do know that there is going to be a wave, but what we're trying to do is slow down that wave so that we can protect people and reduce the number of severe cases that involve hospitalization and death. Through that, we can protect our healthcare system and thereby protect all of us as we may need that healthcare system, especially during this holiday season and the related festivities. It's absolutely, these additional public health measures do bring pressure and strain to our local businesses as well as residents more generally. They do reflect the fact that we all know that business needs to be supported too through this period while we take the necessary steps to protect the healthcare capacity and to save lives. While the public health measures do apply broadly to all of these settings, it is very much that each of us plays a critical role to prevent the spread of COVID-19 and protect the vulnerable through the choices we make each and every day, keeping our guards up and following well-established public health measures. These include wearing a mask properly, a mask that covers from our nose down through our chin and is well-fitting. I do continue to see when I'm out and about people who are wearing them under their nose or under their chin. And so we very much need to remind ourselves and each other to wear those masks properly. Maintaining a physical distance of 2 meters or 6 feet, limiting our contacts overall, and particularly decreasing the size of social gatherings. So as you heard from Grace, the number of contacts in those social gatherings is low, but also choosing how many gatherings one might go to or have. Staying home when we're unwell is very important, as well as, of course, getting fully vaccinated, including a 3rd dose of the COVID-19 vaccine. As part of the vital measures, as people are planning their holiday festivities over the coming weeks, again, referring to that 10 to 25 gathering limit for indoors, or sorry, the 10 for indoors and the 25 for outdoors. Please review those social gatherings, consider your personal circumstances and those of your family members, and make any decisions about changing those gatherings, either reducing the size of them or shifting them to online so that you can reduce the number of contacts. It's particularly important for those contacts who are vulnerable or high risk in terms of complications, people who are elderly, people who are on immunosuppressive therapy, cancer treatment, and the like. Very much encouraging not to attend those kinds of social gatherings and even go so far as to having people help to deliver food and medications to them. Wanted to let you know as we go forward, as you can see, the increasing number of cases that we're experiencing and the number of contacts that we've had. You can imagine the number of people that we're handling through the system is significant, and it's resulted in delays in terms of our notification to people who have tested positive for COVID-19 and their high-risk contacts. So to address this backlog that we're experiencing, we're very much asking individuals who are symptomatic with symptoms consistent with COVID-19, or those who have had the opportunity to get tested and have been found to be positive, to go ahead and self-isolate and notify their high-risk contacts immediately of their COVID-19 status, because the case managers may not be able to reach you. If a close contact tells you they have tested positive, please isolate and monitor for symptoms, even if you're fully vaccinated. I know previously the advice had been that those that are fully vaccinated could go ahead with their daily schedules, but because we're seeing transmission even amongst those that are fully vaccinated, please stay home and isolate. Do not wait for a case or contact manager to contact you. We're asking everybody to do these things proactively as we move forward. We're very much in a transition with this wave in terms of the size and scope. And so it's very important that we each take the actions that we can to reduce the likelihood of spread of this virus. Just remembering, if you do need to isolate from household members, stay in a separate room until symptoms improve, and it has been at least 10 days since those symptoms started. Or if you're somebody who has not experienced symptoms but have tested positive, that's 10 days from when the test occurred. As we go forward, the province is going to be providing more resources for us to help with case management. Our provincial case managers are going to work to identify those cases that are associated with a high-risk setting. So these are congregate settings by and large, and they will be referring those back to us to manage them locally. That is going to allow us in Hamilton Public Health to focus on managing cases, contacts, and outbreaks in our most vulnerable settings. These include hospitals, including complex continuing care facilities or acute care facilities, congregate settings like long-term care homes, retirement homes, shelters, supportive housing, temporary foreign or farm worker housing, and correctional institutions, as well as childcare centers, day camps, and schools when they're in school. It's important as well, as I said, to go ahead and isolate if you're positive, or a close contact of somebody who is positive, while awaiting the province's case managers contacting them. Or if you're waiting, you're associated with a high-risk setting and waiting for public health. Again, it is very important to go ahead and take those measures to limit the spread in those vulnerable settings and to prevent severe outcomes in those who are most vulnerable. Our vaccine rollout, we've rolled out over 960,000 COVID vaccines locally. We're at 83.7% of Hamiltonians born in 2016 or later, or earlier, having received a vaccine to date, and 78.9% fully vaccinated. Nearly 1 in 3, or 32% of children aged 5 to 11 have received a first dose. At the same time, nearly 74,000 individuals have received their third doses here in Hamilton. As you know, we've been doing urgent local planning with the health system partners to scale up in terms of COVID-19 vaccine capacity in Hamilton. Just want to underscore again the magnitude of the tasks that we have in front of us, and the fact that the 18 plus have been added today further intensifies that demand. So as you know, it's for those now that are 18 years of age or older and 3 months since their second dose of vaccine. There are over 320,000 people who fall into that group here in Hamilton. So at this point, we've managed to expand up we're working to expand up to 8,000 COVID-19 vaccine doses per day. We were at 6,000 doses on Friday. And at the 8,000 mark, we'll be able to do 240,000 doses per month. That is if we're able to continue to secure the human resources, particularly health human resources, that we need to have in order to deliver these doses. As we go forward and people become ill or are required to be isolated, that will put further pressure on our ability to deliver the vaccine. As well, we know that we're going to have increasing pressure on our acute care system, and so we'll be prioritizing across all of those things as we go forward. We're very pleased we're up from the 2,500 doses that were administered per day the week of December 6th, and the 4,600 doses administered in Hamilton on Thursday before the St. Joe's Healthcare Hamilton West 5th campus opened on Friday. So the changes in altogether. We've opened a temporary COVID-19 vaccine clinic at St. Joe's Hamilton Healthcare West 5th campus. We are expanding capacity at our existing Hamilton Public Health Services vaccine clinics at the Centre on Barton and the Mountain Vaccine Clinic at Lime Ridge Mall. Our Hamilton Health Sciences West End Clinic, Healthcare Worker Vaccine Clinic is expanded, and our primary care-led Winterberry Family Medicine Clinic has expanded. We've been able to maintain, even with those expansions, the clinic at David Rayleigh Health Sciences, and will continue to add new Hamilton Public Health Services mobile vaccine clinics in neighborhoods across the city. We're continuing to partner with community organizations such as Refuge and the DHAC DAHC, the Détroit to offer COVID-19 clinics to racialized and Indigenous individuals, as well as the Shelter Health Network, who is working to provide vaccines to shelter populations and to our city's residential care facilities. We are very much encouraging people as well to tap into the resources that are coming through the GoVax bus clinics, and of course our pharmacy partners who are distributed throughout our community and are doing a great job at getting vaccines out into people's arms. The city is, of course, as you've heard from Grace, temporarily and urgently redeploying about 100 city employees to assist with the operations of our clinics. The surge we've seen recently is very similar to what we've seen in the past with expanded eligibility, and there's a significant demand for those vaccine appointments. We do expect it will take through to the end of January to provide third doses to all those eligible. We know it's frustrating right now to book appointments at this time as we work through with strained human resources. And we want to make sure, as we did previously, that every appointment we offer can be filled without cancellations. So we ask that people remain patient and be assured there's going to continue to be new appointments added daily, and to continue to check in with pharmacies to see if they can get in to get third doses there. Did just want to note as well, there was a delay at our Center on Barton clinic this morning. This was because of the very vaccine clinic staffing challenges that we have been speaking about. We were able to deploy additional staffing to that clinic to catch up with those who did experience delays this morning and are just continuing to work them through. So we thank everybody for their patience as we work through these situations. To help to lessen the wait times as well on our hotlines, we have added 16 additional staff that are working this week, but the call volumes are anticipated to still be high. I do want to say as well that we are very heartened by those who have reached out offering to volunteer and assist with the vaccination effort. It was great to see people responding to Premier Ford's call last week for a wartime effort, as he said. We don't have volunteers working at this time, but we do have job postings that are posted on our City of Hamilton Jobs at the City webpage. And so please, if you're interested, please go there and check out those clinical and non-clinical roles. So people who are injecting and those who are helping with screening in the clinics, working with people in the clinics as they go through the process. And there are both of those sorts of jobs available on that website. If you are a physician in the community who wants to assist with the vaccination programs, please contact Jill Berridge, and as she's responsible for coordinating physician vaccinators in Hamilton. So as we've said, this is very much a rapidly evolving situation. We'll continue to keep people updated as we learn more about the Omicron variant and the approach to managing cases, contacts, outbreaks, as well as the vaccine rollout here in Hamilton. Thanks very much, and over to you, Mr. Mayor.
Thank you, and that's certainly a lot of information, and thank you, Grace and Dr. Richardson, for sharing that with us. And I know that Hamiltonians are going to be thoughtful about all of that public health guidelines and advice that is being recommended to help us keep the numbers down. We are delighted to see that everyone is eager to get their booster shot. That's a good thing. Unfortunately, we can't have everyone get that booster shot at the same time, and so it's going to take some time to do. And of course, every Hamiltonian plays a role in helping keep our community healthy and safe. So with the opening of that eligibility for the third dose today for 18 plus, naturally there will be a higher traffic volume on the booking system, which obviously has its impact. But we ask you to please continue to be patient as our partners across the system and across the community do everything we can, including seconding people from other positions, to increase the COVID-19 vaccine appointment volumes and ability to actually deliver. So it's going to be a challenge, and the challenge is being met, but it'll take some time to do. So certainly we ask you for your patience, and I know the anxiety and eagerness that comes with wanting to get that booster shot and get everyone vaccinated is a positive thing. Unfortunately, we can't vaccinate everybody at the same time. So we're going to do our very best to get as many appointments in as we possibly can in the short period of time. With that, I'm going to hand it over to Jasmine for some media questions, and I'm sure there'll be a bunch. Thank you.
Great. Thank you, Mr. Mayor. We have 4 media joining us today. As usual, we will start with 1 question and 1 follow-up for each of you. First question goes to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much. Merry Christmas and happy holidays to everyone there. Thank you for taking my question. My first one is just about the Hamilton booking portal online itself. As early as mid last week, people 18 and up were able to go on and book an appointment ahead of seniors and ahead of this Monday opening for vaccines 18 and older. I'm just wondering why that happened and if there's going to be any way to still prioritize the seniors who are maybe more vulnerable over the younger population as we're opening up to boosters now for all adults.
Thanks very much, Nicole. Yes, we call that gating on the systems, and the gating isn't perfect in some of the systems that we have for booking vaccine across the province. And so that we've very much been relying on people to follow the guidance in terms of when they're eligible to book and read that through and ensure that they are following that when they're booking their appointments. At this stage, government has made the decision, the provincial government, to open up to the broader group of 18 plus. And so that is who is eligible to book at this time, very much encouraging people, particularly those who are 50 and up, to look at all sources where they can be vaccinated. They are the priority groups for vaccination in terms of severe outcomes. And so very much encouraging them to look at all sources and move forward with those vaccinations whenever they can.
And you can have a follow-up question if you'd like, Nicole.
Okay, perfect. Thank you. And just my follow-up on vaccines. You're saying that new appointments might become available online on the Hamilton website each day. Do you know how many you plan on adding each day?
Thanks, Nicole. So we'll be going up to that 8,000 per day maximum slowly over the course of this week. It's limited by the number of people that we have able to work in each of those clinics. And so as those people get confirmed that are able to work there, then you'll see that increase up to that level overall.
Great. Thank you, Dr. Richardson. Our next question to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, thanks for taking my questions. My first question is for Dr. Richardson, and it involves the Grey Cup. So is public health concerned that there could be widespread infection from the Corktown pub cases at other events such as the Grey Cup, which was connected to this event?
Thanks very much, Fallon. So when it comes to any sort of gathering, there is a risk, whether that is a small group of people or a larger group of people. And there's factors that can make those more risky or less risky. So of course, we knew when we were dealing with the Delta variant, as we were more so in November, that particularly vaccines made a significant risk difference. And so being vaccinated was very important. As we go forward, we think vaccines are going to continue to offer some protection, particularly against severe disease. And so being vaccinated is still very important with this disease. The other things are things like being outdoors instead of indoors, things like masking, physical distancing, all of those factors that we've talked about throughout the pandemic around decreasing risk. So when we're looking at settings, you can see which ones would pose more risk and which ones less. So we are concerned that there will be cases that may have come about as a result of the festivities that may have been had related to the Grey Cup. We're hoping that people were very diligent in doing the mask wearing and the things that they were asked to do and keeping the number of contacts down and in reducing their risk and the risk for those around them. And we'll continue to monitor as we go forward through the coming days.
Thank you. And I guess, has public health recorded any spread from the Grey Cup game itself?
Anything that's an outbreak that we've had is recorded on the website. And so at this point, there is nothing on the website that's related to the Grey Cup game itself.
Great. Thank you, Dr. Richardson. Our next question to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much. My questions are also related to Corktown Pub. With that event from December 10th, can you share more information about what the event was and how many people were present?
Thanks very much, Katrina. So this was an event that we do understand was associated with a Grey Cup celebration and was a ticketed event. We understand there's about 200 people who were in attendance that day. And that's, I think, the information that we have on that one.
And so those 200 people who would have been there throughout the day, would they all be considered close contacts? And have they been contacted by public health and notified of that?
So whenever we do an outbreak investigation, we go through the situation with the operator to talk about what were the specific circumstances that were there. So anybody who fell into that close contact definition would be identified and asked to isolate, consistent with the kind of guidance that we've been talking about now. So that process has gone through. We continue to go through that until the investigation is complete and the outbreak is declared over.
Great, thank you. Next question to Sebastian from the Hamilton Spectator. Sebastian, you can go ahead.
Thanks so much for taking my question, guys. I had a question for Dr. Richardson. There was a media briefing about 3 weeks ago, and Michelle Barrett said that there was enough testing capacity in Hamilton that residents who wanted to get a test on a given day could do such with no problem. That doesn't really seem to be the case today. If you tried to book a test this afternoon, for instance, you were met with a message that read no appointments were available to book online. I'm curious if this has to do more with an overload on the website or an overload at assessment centers, or both.
Thanks very much, Sebastian. And so, when we're talking about testing in our community, when we're talking about those who've been directed for testing or symptomatic, we're talking about both pharmacies and testing and assessment centers. And so very much encouraging people to access pharmacies as they can for that purpose as well. But we don't have any clarity and insight into what's happening on that front. In the testing and assessment centers, what we are seeing is that they are booking well out. That is due to the number of people who are coming forward for testing. And so that is definitely a challenge for them. We are looking as we go forward. We're aware that we really want to focus on people who are symptomatic, and so that we can get treatment to any of those who also may be at high risk for severe outcomes. And so we're looking and working with the province on how we move forward, as we're expecting the number of cases to continue to surge, and how can we focus the testing to ensure those that are at that highest risk are the ones that are getting tested. Also, of course, very interested in testing those that are associated with those congregate settings and any outbreaks related there. So as we do this work, I think you're going to continue to see updates in terms of where the testing is targeted. Just one thing to note, if people do decide that they don't need their appointment for some reason, if they are no longer interested in getting tested, please make sure to cancel that appointment, not just not show up for it. Because if they don't cancel that appointment, it can't then be booked, of course, by somebody else who really needs it. So just please do, if you've decided you don't need to go forward with that testing, please cancel it out so somebody else can take your place.
Thank you. When would you say or figure that capacity at assessment centers is going to open back up such that people can book an appointment in advance?
Thanks, Sebastian. I think that we're going to see, as we've done before, as we go forward through this wave, numbers of cases are going to go up a fair bit. As you've heard from the science table and the modeling that has been done by those groups, as you've heard from Kieran Moore, that we're expecting cases to go up significantly. We are expecting that people following public health measures can make a significant difference in when and how that kind of increase happens, and whether we are able to spread that out much more, which is exactly what we want to see as a community, or whether that's going to happen more quickly. And so very much what happens in those assessment and testing centers is going to be a function of how many cases there are. And right now we're at a situation where they're very much pressured. And so there's discussions with the province around, okay, how do we manage this situation and go forward to use that capacity in the best way we can to help prevent those severe outcomes. So I think as we go through, that's going to be something that we learn as we go through day by day, week by week through this particular wave.
Great, thank you, Dr. Richardson. We have a bit more time, so we'll go through for one more question each. First question, we'll go back to Nicole Martin. If you'd like a follow-up, you can go ahead.
Absolutely. Thank you so much. And this is also about testing for Dr. Richardson. So I'm just seeing on some of the news wires here now that even in Peterborough, the local public health unit there is asking residents to report positive test results from rapid tests online. If you take a rapid test, which many of us have, been standing in line trying to get our hands on, if it comes back positive, should we still go and get a PCR test? Or do we just assume now that you are positive and stay home and isolate and make those contact calls to people you may have been in close contact with?
Thanks, Nicole. That's a very insightful question as we go through this particular phase. Right now, we are still recommending follow-up of those RAT tests if they are positive to ensure that is the case. However, it's also a reasonable approach to stay home and do that contact notification that we've just talked about. So if you're having any difficulty booking those, please do stay home. Please do continue to isolate. And particularly those who are at higher risk, who are older, who have more risk for severe disease, those are particularly the group that we would want to see come forward for that PCR testing.
Great, thank you, Dr. Richardson. We'll go back to Fallon Hewitt. Fallon, if you'd like another question, you can go ahead.
Thank you. My third question would again be for Dr. Richardson. So how does public health deal with outbreaks when they're connected to people from out of town and they're involved in said outbreak? Are they counted as a local case, or I guess how does that sort of work on your end?
Thanks, Fallon. That's a good question in terms of how they all align in together. So what we do in the system that supports all of public health across Ontario is we do keep track of any outbreaks that are ongoing. And so, for example, between us and Halton, if we have an outbreak that's happening in Hamilton and Halton identifies that they have a case that had that same exposure to that setting, they would then flag that over to us. And the same thing the other way around. So we do track them across. And so we're counting them both in the outbreak numbers overall, but each health unit will have the case itself for their own community and their numbers.
Great, thank you. We'll go back to Katrina Clark. Katrina, if you'd like another question, you can go ahead.
Thanks very much. This question is for Dr. Richardson again. So I know you're mentioning earlier that if someone is found to be a close contact, as in, say, one of their friends tests positive and the friend reaches out and says, I've tested positive, and you're a close contact before anyone from public health is able to reach them. How long does that close contact individual need to self-isolate for, and what are they meant to be doing in the meantime, like getting tested, that sort of thing?
Thanks, Katrina. So the isolation time is 10 days from the time of the last contact. And so we're asking people who fall into that category to maintain that. And as we go forward with this piece around the challenges that Sebastian brought up earlier around accessing testing, if people are able to book a test, then go ahead and do that, particularly if you fall into those higher risk groups or if you're symptomatic. Those are the groups that we really want to focus on right now. And what you'll see as we go forward is we work with the province on how can we further streamline this and make sure our resources are really targeted to identifying those who can best benefit from treatment, are part of these outbreaks in congregate settings, part of protecting those settings. You'll hear more updates to that guidance in the coming days.
Great, thank you, Dr. Richardson. We'll go back to Sebastian. If you'd like another question, you can go ahead. Oh, I think we might have lost Sebastian. Okay, Mr. Mayor, that's the end of our media questions, so I will pass things back to you.
Great. Thank you very much, Jasmine. And thank you to the media for their questions. And hopefully we'll be sharing some good information with our community at large. Thank you, Bill Custers, as always, and Cable 14 and Clear Cable for your assistance in pulling this media briefing together. And thank you to the media partners that I just mentioned. And for more information on COVID-19 and the financial supports and any updates, visit the website at hamilton.ca/coronavirus. You'll get all the information you need there. And please do continue to follow all public health measures and get your vaccine as soon as you can and booster as soon as you can. Again, given the challenges that are out there in terms of staffing and availability of expanded clinics, it is going to take some time, but everyone will get that booster shot ultimately and eventually over the next month and a half or so. So you can get the latest information on the website for the coronavirus as a whole. So go to hamilton.ca/coronavirus or by following us on social media. And we are going to be back here, if not sooner, but certainly on Monday, January the 10th, for an additional briefing on COVID-19 related matters then. So we'll look forward to seeing you then. And in the meantime, have a Merry Christmas, or do the very best to have as merry a Christmas as you can make it. And thank you for tuning in, and we'll see you soon in the new year.